Buenos dias, and welcome to the weekly grand rounds here at Sinclair, an integrative psychiatric holistic facility. And today I'm Jim Ellermeyer. I'm a behavioral health therapist here at Sinclair, and today on my right I'm joined by my colleague.
I'm Nicole Smallic. I'm a physician assistant student from Marietta College.
And we're fortunate today to have Miss Sarah Heber with us. I hope I'm pronouncing your name correctly, Sarah.
You are.
How about that? So could you tell us a little bit about yourself? Give us a little bit of your background, if you could, please.
Sure. I graduated from the Academy for 5-Element Acupuncture in Gainesville, Florida last year, and finished my boards, and I opened my business here in Bloomfield, Pennsylvania, right across from Children's Hospital in March. Before that, I was an instructor at the University of Pittsburgh, teaching English as a second language, and I'm still known to do that from time to time, like this semester. So a lot of things going on for me.
Wonderful. It was nice meeting you out at the What's on Your Plate affair out at Robert Morris College on Saturday.
It was. That was a great event. I had such a wonderful time.
It was very nice. A lot of like-minded individuals out there. Mm-hmm. Speaking of like-minded individuals, when you tell people that you do acupuncture, what is a common misconception that people have?
A lot of people think it's just for pain, but in fact you can use it to treat almost anything, because in acupuncture, looking from the Chinese medical perspective, we're not really treating a westernized group of symptoms with a name, like fibromyalgia, for instance. We can definitely treat that, but what we're treating is a pattern of disharmony. So we would look at it more as, is it a hot condition, a cold condition, an excess condition, or a deficient condition? Deficient meaning qi, or the energy. So we can treat almost anything, and emotional and physical symptoms as well, not just pain.
Could you give us a little background on acupuncture?
Sure. It's been going on in China, started in China and in the East for thousands of years. They believe it got started during battles and war. If someone would get hit in the leg with an arrow, for instance, maybe their eye problem would clear up, or a stomach ailment would clear up. And over time, they connected getting hit or stimulated on certain points of the body with other areas, digestion, mental, and all the organ systems that are included in the 12 meridians. So that's where they think acupuncture started. And from there, it's spread throughout the world. They even have instances of it throughout Europe in the Middle Ages, and even some of these, early man, that they're finding, the guy that was, I can't think of his name right now, on the ice mountain they found him. They had tattoos, and they believe some of these ancient tattoos on these ancient folks they're digging up corresponded to acupuncture treatment points as well. So it has a very rich history, many schools of thought, many traditions, and today TCM is the most common tradition, which stands for traditional Chinese medicine, but I'm a practitioner of another branch called 5-Element Acupuncture. And they're all tied together, just you approach the treatment from different perspectives.
When someone mentions acupuncture, when someone mentions energy medicine, I noticed on your flyer that you have Chinese Qigong. Could you help us understand a little bit why the Eastern philosophy and modalities have had such a difficult time penetrating Western allopathic medicine?
I think it has to do mostly with the concept of qi. Qi loosely translates in English to energy, but it's something that we really still can't measure or see. So people in the Western tradition, we like evidence, we like science, we like studies, we want to see it, we want to know how it works. There's a lot of studies going on now that show how acupuncture works, and there's a lot of Western theories that have to do with neurotransmitter release, hormone release, getting the body to, initiate white blood cells to come to certain areas for healing. But I think it hasn't been widely accepted in in Western medical circles because of this concept. It sounds kind of esoteric. It sounds almost magical, this energy that we can't see. But really, if we're thinking about what qi is and what it does, it's all about the function. So the function of the stomach, the function of the spleen. And when we use those terms with a lot of Western medical practitioners, it makes a lot more sense to them, and they're a lot more open to the concept of what qi really is the function. And
I see a lot of younger people, particularly today, a lot of young ladies, as a matter of fact, have tattoos.
Mm-hmm.
And they tell me that these tattoos are rather painful to be put on. I've never had the courage to get any ink myself. However, could you explain to the folks that may be watching today what the difference is between tattooing with a needle and the type of work that you do?
Okay, well, I can talk from experience. I have had a tattoo. And a tattoo, it is a tiny needle going in and out very, very quickly, and you're going a lot deeper into the dermis and the epidermis than you are with acupuncture. The difference also between an acupuncture needle or a tattoo needle or hypodermic needle is their hypodermic needle is hollow and it's big, and you're meant to cut into something so you can insert, a vaccination, a liquid, or draw out blood. Acupuncture needles are very thin, about as thin as a hair or a cat's whisker in most instances, and they're flexible and they're solid. So you're not cutting really through anything. You're going into the point, and you're not causing a lot of trauma in the area. Tattoos, you're adding ink to an area, so there is some more trauma there. And from experience, I can say that a tattoo feels a lot like a brush burn, and kind of a deep brush burn. But acupuncture, if you feel anything at all, it really just feels like a little sting. What most people feel is a sensation of the qi. We call it the qi, or the arrival of qi. And because it's such a unique feeling, we don't really know what to call it, so we quantify it as pain, as the sensation. But that's different from the needle going in. You really almost never feel that. The qi sensation is more of a pulling, tingling, sometimes a warmth or a heaviness in the area. And sometimes that just lasts for a few seconds. And that's really what acupuncture feels like in comparison to getting a vaccination or a tattoo. It's very, very mild and almost painless.
Could you tell us what most folks present with when they come to see you? What type of issues do they come to you with?
Sure. A lot of people come in for pain and injuries, and there is a lot of research on how acupuncture can help these things. I see a lot of knee problems, shoulder problems, a lot of lower back problems as well. Those seem to be the most common pain issues that come into my office. Another thing I see a lot of is stress and anxiety. Acupuncture is really wonderful for treating emotional disorders. And most of us in our modern era, we're stressed out. So acupuncture can really help slow you down, get you into that rest and digest mode, and really help you to manage. So people that tend toward frustration or quick anger, they learn how to take a breath and manage that better. People that are constantly worrying or anxious can turn off their brain a little more. Acupuncture just really helps you feel even and balanced and helps you to manage that kind of stress. We also see digestive issues, a lot of IBS, constipation. We also deal a lot with menopause, PMS, menstrual symptoms, and that's also related to stress. It's all related to the liver, which is the smooth flow of qi. So that takes care of stress, anxiety, and some of these issues we see with menstruation. So those are the most common things.
I'm glad that you brought up stress, as most people, a common presentation is with depression and anxiety. Mm-hmm. And one of the reasons that people come in, I'll ask my colleague, Miss Nicole, what time it is.
It's right now.
And most people, when I ask them that, they look at their watch, they look at their phone, they look at a clock, and it's what's like in Alice in Wonderland. I'm late for a terribly important date. Everybody is so late and so overwhelmed with everything that's going on in their lives. Mm-hmm. And we try to help people understand that their lives can be simple. We're just experts at complicating them. And that one of the things about time is the more we slow down, the more time slows down. So I'm interested in dealing with this stress and anxiety issue. and acupuncture. That's fascinating. Tell me some of the results that you've seen, Sarah.
Well, I can tell you from personal experience, and this is what really got me interested in becoming an acupuncturist, is that for years I suffered with a lot of panic attacks, anxiety, generalized symptoms, and also some depression symptoms. And, you know, I tried an antidepressant at some point, and it helped, but, you know, you had the other side effects. I gained weight, I was tired all the time, I just kind of felt, ugh, you know. And I actually got acupuncture for a knee injury that I suffered from Kung Fu, and I decided to try acupuncture, and I noticed I had these other side effects that were all positive. I was sleeping better, my mood was even, I wasn't having this constant anxiety. And I looked into it more and more, I kept getting treated, and I realized that it's something that could help with that. So personally, it's helped me to really reduce any anxiety symptoms. When I do sort of get into those old patterns, if I'm feeling stressed out and worked up, I've learned how to just sort of let it go and just ease through these emotions more quickly and smoothly and not get stuck in them. I think what we do when we do have these kind of disorders, whether it's worrying or obsessing or panic, it becomes a pattern. Whether we like it or not, it's what we know and what we really become, and it takes over. So with acupuncture treatment, it gets you out of your head. It roots you, it grounds you, it takes you into the present. So you're not worrying about the past. You're not obsessing about what's happening tomorrow. It is bringing you into the now, and I think that's a really important thing that we lose sight of. So it helps you say, I'm okay right now. And it helps you manage whatever problem comes up, and it helps you heal on a deeper level. It doesn't just mask the symptoms like a medication would. Sometimes you have to really look at yourself, look at the root, what happened in your life that led to these symptoms, and we can work on that too, a deep level of healing. So that's what we focus on, especially in the 5-element tradition with anxiety and depression. Look for the root. Where did it start? What pattern are you suffering that's keeping the symptoms going, and then also just healing it on a deeper level and doing some of these techniques like breathing and being in the now.
Well, Nicole is here on her psychiatric rotation, and quite often she'll sit in with me and I'll ask people whether they believe time travel has been invented, and most of them tell me no, and then I'll suggest to them that they have frequent flyer miles going from the past to the future with no stopovers in the present, and that's interesting, and that's a like-minded situation that we have here at Sinclair, as we tend to not label individuals. We don't like to look at people as simply depression or anxiety or pain or a condition. What we like to do is look over and examine the whole environment of an individual and offer them enhancements, not simply chemicals. Our philosophy is the least amount of chemicals in a body that's possible. So could you share with our audience today how they could reach you, Sarah?
Sure, absolutely. Probably the best way to get in touch with me would be via my website, which is www.lifebalanceacu.com. That's just ACU at the end. If you're interested in scheduling an appointment or a free consultation, you can do so on my website. There's a calendar there. It's easy, just one click, and you can get in touch with me. Also, if you prefer to call, my phone number is 862-243-2574, and my email is info@lifebalanceacu.com.
And I understand you're going to be here at Sinclair on Wednesday, November 5th at 9 o'clock for a demonstration. That's great. We'd love to see you before then, Sarah. And we thank you so much for joining us today.
This was wonderful. It was nice to meet you.
That
Thanks.
was just great. I hope to meet again.
We will.
To meet again soon.
I'll see you guys soon.
Thank you, Sarah.
Thank you.
All right, and so to continue the conversation, please like us on Facebook, plus us on Google+, or follow us on Twitter under Sinclair Life, and keep an eye out for any of these for our next live recording, Mondays around noon, to ask your own questions. And you can also find this and other ground rounds on youtube.com/Sinclair video and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. And please visit www.sinclair.com for more about us and other articles on our great blog.
And today I'd like to write everyone a prescription, number 1 for hope, and number 2 for a prescription for fruits, nuts, and vegetables. Unplug your television and perhaps take out fishing. And me and my good friend Sven often do some mindful fishing, and we fish without bait. So until the next time, it's been wonderful. Thank you.